If a person wants to make an appointment, sometimes people call and want to ask questions, and sometimes they call and just want to make an appointment. So both of those situations, my receptionist will take the person's phone number, and I'll try to call them back within the day. People with questions, I try to answer their questions. People that want to make an appointment, I ask them questions like, what is the reason why you want to make an appointment? And try to answer their questions about what my approach might be for their condition, etc. So almost always they say, well, I'd like to make an appointment then. So we forward them a questionnaire, and they complete that. They return that to us by simply attaching it to an email to us. I ask them to forward any labs they've had done in the last 6 months, maybe even a year. I will review their answers and see if we have enough information from the tests that have been done before. If we don't, I call them back and I explain what is missing from their labs and why it's important that we get those tests done and what it's going to show us. And always they agree with that. So I either give them a list of those labs which they can take to their doctor if they have insurance, or they can order the labs through us. We use LabCorp of America primarily, or Labrix for saliva hormone testing. I don't deal with insurance companies, but our prices are extremely reasonable. So either way, they get the labs done through their doctor or through us. Once all those results are back, an appointment is scheduled for them. The appointments last for often an hour, but sometimes longer. The person is given an hour and a half appointment. Whether I use all that hour and a half or not depends upon what transpires during that consultation. What I charge for that time for the consultation, I don't charge for reviewing their questionnaire and calling them about what lab should be done, but that consultation I charge by an hourly rate of $200. So if we only use 45 minutes, it's $150. If we run over to like 1.5 hours, it's going to be 1.5 times 200, which is $300. So that's pretty much how people make appointments, and I'm happy to answer any questions people have when they call. Sometimes people they don't know about alternative medicine all that much and what the approach might be and what's covered with that. Sometimes they've been to a lot of other alternative practitioners and they want to hear how my approach is different, because they've been through the mill, they've tried it hasn't fully worked for them. So that's how a person goes about making an appointment. And appointments, we try to reserve times for new patients, because I know that people want to get in as quickly as possible. So usually the wait is anywhere from maybe a week to 2 weeks to make an appointment. That's how things stand right now, anyway.